السلام عليكم. معكم دكتور محمد القحطاني من إدارة مكافحة العدوى. واليوم إن شاء الله راح نتكلم في هذه المحاضرة عن ال Standard and Transmission Based Precaution كمقدمة بسيطة لتسهيل عنوان المحاضرة. Standard Precaution هي احتياطات مكافحة العدوى الأساسية التي يجب اتباعها عند التعامل مع جميع المرضى، وعندنا أيضا احتياطات لمكافحة العدوى إضافية تكون داعمة للستاندرد بريكوشن يطلق عليها Transmission Based Precaution. من المسمى نفهم أيضا أنه الاحتياطات الإضافية هذه يتم اتخاذها بحسب نوع انتقال الميكروب أو حسب انتقال العدوى. طيب، في البداية عشان يكون عندنا استخدام صحيح للستاندرد بريكوشن اللي هي الاحتياطات الأساسية أو القياسية من إجراءات مكافحة العدوى، لابد إن إحنا نعرف سلسلة حدوث العدوى اللي هي الchain of infection. فالchain of infection تحدث إنه يكون عندنا الميكروب المسبب للإنفكشن. هذا الميكروب ينمو يتكاثر في الحاضن الطبيعي لهذا الميكروب. يمكن يكون الحاضن ممكن أن يكون كائن حي أو كائن غير حي مثل الإنسان، الحيوان، أو ممكن يكون كائن غير حي مثل الأتربة والمياه. ثم ينمو ويتكاثر هذا الميكروب. بعد ذلك يجد طريقة للخروج من هذا الحاضن وهو يطلق عليها البورتال اوف اكزيت. بعدين يحصل له موبيلايزيشن حتى يجد بورتال اوف انتري او نقطة للدخول للأذر بيرسون ات ريسك لهذا النوع من الانفكشن. فبالتالي معرفة مفهوم التشين اوف انفكشن بيساعد بشكل كبير للفولو اب لاستخدام الستاندرد بريكوشن to break the chain of infection and stop or prevent the infection. طيب, now we will talk about the infection transmission, طرق انتقال العدوى. In dentistry, general route for disease transmission, we have main two methods of disease transmission in dentistry. Direct contact, انتقال مباشر من خلال direct contact with the lesion or the infected body fluid of the patient, like the blood or the saliva, or even by direct contact with tissue debris during the intraoral procedure, and also including needle stick injury that may happen during the intraoral procedure. So it's called direct contact because you directly contact with the patient body fluids. indirect contact, الانتقال الغير مباشر، حيكون من خلال contaminated dental instrument or equipment or material، من خلال الاتصال مع الأسطح أو الأدوات الملوثة بشكل غير مباشر. Or even can be transmitted by inhalation, and it's one of the indirect method of disease transmission. When you inhalate the aerosol that are generated from the procedure, such as the tooth preparation, when you use a handpiece or ultrasonic scaling. So some microbe, they have a particle size very small that can be suspended in the air for a long time, and the person may inhale these particles. So from all the introduction in the previous slide, we conclude that the standard precaution are the infection prevention practices that are used to avoid the transmission of infectious agents. It is the first line of defense to break the chain of infection. And we will, inshallah, take the definition of the standard precaution and the component of this standard precaution in the next slide. So what are the standard precaution? The definition of standard precaution are the minimum infection prevention practices that apply to all the patient care regardless of known or suspected infection status of the patient. It assumes that the patient or any patient blood or body fluid may be infectious. What that mean? That mean the standard precaution, it is a basic infection control measure or step that are followed by the dental healthcare person to protect them and protect the patient from the infection, even if we know the infection status of the patient or no. And this standard precaution will prevent both the dental health care person and protect the patient. And we will know what are the components of the standard precaution and what are the steps of standard precaution. So the effectiveness of standard precaution will depend on how these steps or measure be followed uh, at all the time. So again, the purpose of standard precaution is to decrease the risk of transmission of the blood-borne and other pathogen from the known or unknown sources. Very important also regarding saliva, it always be considered a potentially infectious material in the dental care infection control. So we have to follow the standard precaution when we deal with the patient saliva. So what are the standard precaution components? It include the hand hygiene, doing the hand hygiene practice by the right way at the right moment, using the personal protective equipment. It include the gloves, the mask, the eye protection. It's include also the respiratory hygiene and the cough etiquette, and each component of the standard precaution you will take it soon in separate lecture. It include also the sharps safety, that mean using the engineering control and the work practice control to minimize the sharp injury. Safe injection practice, when you always follow aseptic technique when you inject or giving parenteral medication. It's also include the sterile, using sterile instrument and devices all the time, and also include cleaning and disinfecting the environmental surfaces. When the standard precaution alone cannot prevent the transmission, they are supplemented by extra measure or added measure. We call it transmission based precaution. We use this precaution if the patient have disease that are spread by contact or droplet or airborne route. So the transmission based precaution, it is a supplemental measure or supplemental precaution that are added to the standard precaution if we know the infection status, or if we know the patient that are diseased by infection that are transmitted by contact or droplet or airborne routes. And we know the dental setting are not typically designed to carry out all of the transmission-based precautions that are recommended, for example, for hospital and other ambulatory care setting. Uh, Also, the patient, however, do not usually seek routine dental care when they are actually ill with disease requiring transmission-based precaution. So, as a summary between standard and transmission-based precaution, the standard precaution that are the basic infection control precaution that are applied to all the patient care activity regardless if suspected or confirmed infection status of the patient. The transmission-based precaution are added measure or extra measure to prevent the spread of the disease from the patient with known or suspected disease. So what are the type of transmission-based precaution? We have three main type of transmission-based precaution. The first one, contact precaution. It is the precaution used for disease that can be transmitted by contact with the patient or the patient environment. The second one, it is the droplet precaution. It includes the microbes that are transmitted by large respiratory droplets. And the third one, the airborne precaution. This precaution, which used with the patient that are infected by microbes that are transmitted through the air. So the pathogen size are very small that can remain suspended in the air. So, according to the microbes and its transmission, the patient should be placed into the appropriate precaution as soon as possible to prevent the unintended exposure to the healthcare person and the other patient or families or the visitors. If we take it in detail, this all three type of transmission-based precaution. The first one, contact precaution. It is methods used to contain disease that are spread by either direct contact, that means contact with the patient, for example, contact with the patient's skin or the mucous membrane, or the patient vomit or urine or wound drainage or other body fluids, or by indirect contact, for example, contact with the patient's environment or surrounding that may be contaminated by the patient fluids. So this type of precaution will be applied to a patient infected by a known or suspected infection by a microbe that are transmitted by contact, or others that are epidemiologically important to the patient. It also will be applied to a patient at risk of contaminating their environment. For example, patient with fecal incontinence or uncontrolled wound drainage or other excretion or secretion of the patient. For example, of microbes that are transmitted by contact, we have as example the Clostridium difficile. So the personal protective equipment needed for contact precaution, you will wear a gown and gloves at the entry point and before contacting the patient or the patient environment. And the PPE should be done prior to the room entry and doffed at the point of exit of the room. And it's include placing the patient in single patient room, or if the single patient room not available, you can use the strategy of patient cohorting. That means placing the patient with the same or similar infectious agent in the same room. with strict adherence to the infection control measures. And it is very important to know the most frequently contaminated object to direct the disinfection and cleaning activity. These objects include such as the tray tables and the bed rails that are most frequently touched by the healthcare worker or by the patient. It includes also the medical equipment that are used for the patient, like the blood pressure cuff. The contact precaution also include using dedicated patient equipment, and the rest of personal protective equipment can be used according to the procedure performed on the patient. For example, if you anticipate there is splashing of fluids or blood during the procedure, you will wear a mask and eye protection in addition to the gown and the gloves. And of course, performing the hand hygiene before wearing the PPE and after the PPE removal and when needed. The second precaution of the transmission-based precaution, which is the droplet precaution. Droplet precaution are used or designed to prevent the spread of pathogens that are passed from the respiratory secretion and do not survive for a long time. These droplets are relatively large particles, so it is large in size that cannot travel a distance in the air when they exit from the respiratory secretion of the infected person. So the droplet precaution aim to prevent the transmission of disease that are spread by a large respiratory particle or large respiratory droplet through the patient coughing or sneezing or even by talking. It also include using of single patient room. It is preferred, and the patient cohorting also can be done if the single patient room is not available, with the strict adherence to the infection control measures. An example for microbes that are transmitted by droplet, for example, seasonal influenza and the Bordetella pertussis. The personal protective equipment for the droplet precaution, it includes using the face mask after doing the hand hygiene. It is worn upon entry into the patient room. It's actually considered to be within 6 feet or less, or in the patient room. Uh, so the face mask is mandated. Respirator or N95 face mask is not necessary, but can be used in specific situation. When you are doing aerosol generating procedure, you can use the respirator on N95 face mask. It includes also following the standard precaution when you're handling any items that are contaminated with respiratory secretion. Personal protective equipment must be removed at the point of exit from the room, and very important, do not reuse the face mask after removal. It is very important also to know for some infection like the influenza, the eye protection might be necessary, or when you anticipate splashing of fluids or secretion, you will wear the eye protection, and the rest of personal protective equipment can be used, as we say, according to the procedure performed. So you can use the gloves and the gown with the eye protection if you anticipate the splashing of fluid or patient secretion. The hand hygiene, of course, following the PPE removal. The third one, which is the airborne precaution or the airborne infection isolation. This type of precaution aim to prevent the transmission of infectious agents that are very small in size and that can be remain viable and suspended for long time in the air and for long distance. On this situation, the patient should be placed into a negative pressure isolation room that contains special air handling and special ventilation. This air handling and ventilation capacity include monitoring system that providing negative pressure relative to the surrounding area such as the hallway to prevent spreading of this infection outside the negative pressure room. The air is exchanged at a rate faster than any other area in the healthcare setting, with the air exhausted directly to the outside or HEPA filtered. Example of microbe transmitted by airborne, for example, the measles, Mycobacterium tuberculosis, and the chickenpox. Personal protective equipment for the airborne precaution. It requires using particulate respirator N95 or using a powered air purifying respirator, the PAPR. It is worn before the entry of the room, and it is recommended to do the fit test for the healthcare worker before entering any area that may be airborne infectious disease. The fit test will make sure that the N95 mask has a tight seal against the face. And the bubbers usually selected if the N95 respirator does not fit or if the employee has a facial hair or facial deformity that alter the seal of the N95 mask or respirator. The rest of the PPE can be used as we mentioned before according to the procedure performed. Again, like what we say before, it is important to bear in mind that droplet could be aerosolized in aerosol generating procedures. For the patient transport, for all isolation type, it is recommended to limit the transport and movement of the patient outside of their room, but if it is necessary to transport the patient, there should be a good handoff communication between the staff about the type of isolation precaution needed for the patient. That means there should be a good communication between the transferring department and the receiving department about the type of precaution for that patient. For a patient under contact precaution, you make sure any infected area must be contained and covered, and the healthcare worker should wear gloves during the transport. For patient under droplet precaution, the patient should wear a surgical face mask and instructed to follow the cuff etiquette when outside of their room, and the healthcare worker should wear surgical mask only if the patient cannot wear or tolerate the face mask. For a patient under airborne precaution during the transport, the patient should wear a surgical face mask and instructed to follow the cuff etiquette, and the healthcare worker should wear the N95 only if the patient cannot wear or tolerate the mask. Healthcare worker also should perform the hand hygiene after handling the patient. The application of transmission-based precaution in the dental setting, particularly in the outpatient dental setting, the adherence to source control measure and standard precaution should be sufficient to avoid the disease transmission by contact route. The contact precaution are used to prevent the spread of organism among the patient and the healthcare worker by the contaminated hand and by exposure to the patient care equipment. For the droplet and airborne precaution in the dental setting, it is used to avoid the transmission of epidemiologically important diseases that are spread by exposure to the oral or the nasal mucosa and the pulmonary system. For example, COVID-19, pandemic influenza, measles. This precaution rely on the following respiratory hygiene and cough etiquette program, and this is you will take it inshallah in separate lecture, using also the strategy of source control measures, work practice control, and engineering control to reduce the number of potentially infectious droplet and aerosol in the clinical environment. And very important to know that the transmission-based precaution should be implemented as a routine for potentially infectious patient for all procedure in the dental setting and for all result generating procedure when there is declared moderate to substantial community transmission of highly infectious disease or during declared public health emergency like the pandemic COVID-19 before. During the pandemic COVID-19, there is many precaution followed during the pandemic from infection control. One of these precaution, the dental healthcare practitioner are advised to limit the number of the staff inside the practice or inside the clinical area to minimize the exposure between the healthcare worker themselves and the patient. The also application of physical distancing, especially in the waiting area or in the employee room or during the coffee break or lunch. One of the measure also or the precaution, the daily screening of the healthcare worker to before entering the dental area by measuring the body temperature. All the dental healthcare practitioner and the other employees should be advised to self-monitor themselves for emerging of fever or other signs of COVID-19 like coughing or shortness of breath, and immediately notifying the employee clinic if they have any sign or symptoms of COVID-19. And when the dental healthcare worker are confirmed to have COVID-19 infection, they must follow the recommendation of the employee health clinic according to the Ministry of Health guideline concerning the resuming of their work. Here also the continuation of the precautions that are followed during the pandemic COVID-19, triaging the patient when they enter and giving them a face mask to apply the source control, using of the electronic payment method instead of the traditional method or the cash method to prevent the physical exposure and the cross contamination of the infection, removing all the material that are or the material that there is possibility of physically exposure to the pathogen, like the removing the magazine reading material, removing the toys, also the non-essential furniture. Place a transparent barrier in the front of the check-in desk. Also, one of the precaution is the physical distancing in the waiting area between the patient while they are waiting for the appointment by applying at least 1.5 to 2 meter and putting all the required supply for doing the hand hygiene like alcohol dispenser and a tissue touchless waste container and distribute the science or media screen for giving all the patient the instruction for cough etiquette and hand hygiene technique. As a continuation also of the precaution followed during the pandemic COVID-19, the patient may remove their face mask until they finish the dental treatment and should put it back when they are leaving the dental clinic. One of the precaution also during the pandemic COVID-19, the dental healthcare worker advised to wear the surgical mask all the time while they are in the dental setting. Also, the correct disposal of the respirator that are used by the dental healthcare worker outside the dental clinic, and also the extended use policy that are introduced during the pandemic COVID-19 for the respirator that should not be applied in the dental setting. And in the last, the using of the respirator with suspected or confirmed COVID-19 patient when you are doing aerosol generating procedures. Here are also some strategies that are used to reduce the transmission risk during the COVID-19 pandemic. It includes avoidance or minimization of some procedure that may increase the risk of aerosol generating whenever possible, such as the ultrasonic instrumentation. This is one of the strategy to reduce the risk of infection. Prioritize the use technique during the treatment to decrease also the risk of aerosolization. For example, prioritize the use of manual instrumentation or either using low speed handpiece whenever possible to reduce also the same concept of reducing aerosol generation. Also, the use of the high volume suction on the dental rubber dam to minimize the droplet and the spatter and aerosol that are generating during dental procedure. It was found that it will eliminate the contamination by at least 90% to 98%. For the suspected or confirmed COVID-19 patient should be avoided from any non-emergency dental procedure and postpone this dental procedure until cleared. In case of the emergency dental procedure and the treatment cannot be postponed or delayed, the following measure must be applied during the treatment. Like, for example, using of oral rinse, the dentist should instruct the patient to rinse his mouth for at least 60 seconds prior to the examination of the oral cavity. Example of the oral rinse, like 1% bufidine iodine or hydrogen peroxide for 60 seconds. Also, one of the major try to use the extraoral radiographs instead of using intraoral radiograph to minimize also to the exposure to the oral cavity or oral secretion. The dentist also must avoid the aerosol generating procedure whenever possible and using instead the lowest aerosol generating option available at that time. In addition to the use of the high volume evacuation or suction and the use of the dental rubber dam, like what we say in the previous slide, should be mandated in the suspected or confirmed COVID-19 patient. In case of the aerosol generating procedure non-avoidable and there is necessity to do aerosol generating procedure on suspected or confirmed COVID-19 patient, dental healthcare worker should wear the appropriate personal protective equipment, and it include wearing a fit-tested respirator or bubble, or using a surgical face mask if the respirator is not available, in addition to the wearing the gown and the gloves and the eye protection. Also, the number of the dental healthcare worker inside the clinic should be limited to the team that are involved directly in the dental procedure, and if available, using a portable high efficiency particular air HEPA filter could be used near to the patient chair, and avoid to put the HEPA filter behind the dental healthcare worker, because it will direct the air turbulence toward the dental healthcare worker, and ensure the position of dental healthcare worker in appropriate position, and avoid the position of the dental healthcare worker not to be between the unit and the patient mouth. After the aerosol generating procedure done, the dental unit should have enough time for proper ventilation before starting the terminal cleaning and disinfection, and before receiving another patient. It is recommended to wait 15 to 30 minutes after the dental treatment and before starting the terminal cleaning and the disinfection, to let the HVAC system and the portable HEPA filter to remove the aerosol from the contaminated air. One of the recommendation also, whenever possible, the dental healthcare practitioner included in the high-risk group, for example, the unvaccinated dental healthcare practitioner, or the one with low immunity, whenever possible, should be restricted from providing dental care for suspected or confirmed COVID-19 patients. Thank you for listening, and I wish you all the best in your program.